So Going Forward is the name of our project, and the ultimate aim of the project was to determine the impact of sex and gender-related factors on health across countries and across diseases. And we really were trying to identify gender-related measurements, if there were any out there, how gender is being measured and being collected. And then we were looking at multiple databases, data sets from all the different to determine if there are disease or country-specific constructs as far as gender is concerned. And ultimately, our plan was to measure the association of gender with outcomes, health outcomes, in various chronic diseases, to determine down the road if there were interventions that could be gender-related interventions, so that we could create interventions that would help improve people's health via gender-related interventions. So that's the really global picture of what we were trying to look at.
So this has actually been quite a bit of a journey for us. We started maybe in the late 2000 with a project that was looking at sex and gender differences as it relates to cardiovascular diseases. And as a group of investigators, we were wondering, what's the difference between sex and gender? And then being epidemiologists, we wanted to figure out a way to measure gender. So just to define, sex is really the biological differences between male and females in terms of their genes and physical characteristics. And then gender was like, okay, what is gender? And then we in group discussions and all that, and with reference to documents that the Canadian Institute of Health Researchers worked to better define gender, we arrived at understanding that there are different constructs of gender. There's the gender identity and the roles that are gendered in our society, the relations, how we relate to other people according to our gender, and also how institutions value and deal with men and women in society. So under those 4 rubrics, we said if we want to find what is the impact of gender on health, we need to be able to come up with a measure. So under those 4 rubrics, we came up with some questions that would measure these aspects of gender, so that, in order to be able to see if gender impacts on health, and also in order to be able to develop intervention, we really need to understand how how you measure gender. So we came up with some measures of gender, and first we had a questionnaire that was measuring these different aspects of gender, and then we applied that to our consortium in terms of how to find measures of gender within each of the databases that we've been able to collect so far. So just to say that, the journey is started, and now we're a while back, and now we're able to better apply this knowledge to the current project.
So first of all, I need to acknowledge that we are a 4-country international network of researchers in sex and gender, and each PI who is on board has accessibility to databases that can be either registry or observational cohort or administrative databases that include individuals with no communicable chronic disease. And our clinical setting of interest is cardiovascular disease, chronic kidney disease, metabolic disorder, especially diabetes, and then neurological disorders. So once we have these 33 cohorts of study population, what we decide to do, and what we have been doing in the first year of the project, was to develop a standard methodology that can be applied to retrospective studies, so already collected data, For testing, as Dr. Norris said before, the association between gender-related factors with outcome, both clinical cost-sensitive outcome, because we think that it's very important for the healthcare system, and also, and most likely even more important, the patient-relevant outcome. And we want to look at this aspect in international setting and taking advantage of the cross-country comparison between databases. This is because in the definition of gender that Dr. Pilote just provided, we really think that gender, because it's a social construct, it's gonna change by culture and by country. And briefly, I can describe you our methodology. It's a
yes, please.
It's a five-step approach. Step number one, you need to identify the gender-related variable in your cohort. What we did was asking to all our partners to send us the data dictionary of the database. So we create a preliminary list of gender-related variables. Then we get together in Montreal for the kickoff conference of the project. And what we did was discuss with all PIs and the stakeholders that participated to this conference, what is gender, and among the variables that we had, which are the best that fits our conceptualization of gender. And so we create this wish list, we call like that, of gender-related variable. And then step number two, we specify, and we want to be very clear about the definition of our outcome, because when you want to compare different databases and different countries, you need to make sure that you are measuring the same variable. Yeah. And so what we did was to define, there was a working group that was tasked to do that. And we decided to use the ICOM framework. ICOM stands for International Consortium of Health Outcome Measurement. That basically it's a list of standard definition of relevant outcome for a given clinical condition. And so this was our best definition that we decided to apply. And then once we have the wish list of gender-related variable and the wish list of the outcome we want to test and to explore, step number three, you need to actually cross-validate this wish list locally in each country and in each database. So you can, at the end, came up with a feasible list of variables that you actually have and you can explore in your project. And then step number four, you need to make and to check that the variable the list of variables that you have finally selected measure the same aspect in each country. So you need to perform an harmonization of the data and to create an harmonized core data set that then you can use for your analysis. And to do so, we use a methodology that has been previously validated for retrospective studies. And then finally, step number five, you really need to be aware about the data structure of your database, because you know there are lots of issues that are related to transferability of data, privacy, data privacy. And so basically we realized that when you run a project like this, there are four main scenarios that you can face. First of all, all the data can be transferred from a country to the other, which is the easiest case, but also the rarest case, because it's really not feasible as an option. So you need to find solution if you want to perform this cross-country comparison. And the solution are, number one, if the data cannot be transferred, what you and cannot so analyze centrally, what you have to ask to your partners is to run and estimate the effect of gender in their harmonized data set that they have locally, and then provide you the estimate, the study specific estimate of the effect. And as a coordinating team, what we can do centrally is perform a meta-analysis of this data.
Okay.
Option number 2, what we can, if it's possible that data are accessible but not transferable from the local center, what you can go for a federated analysis, which can be done by the central, the coordinating center. And option number 3, which is the most innovative, you should use some technique which is called synthetic data. Luckily, you can create synthetic data starting from the actual data that cannot be transferred, and then you will be able centrally to pull all these synthetic data and analyze them for exploring your research question. So that's briefly what the methodology implies.
So just to add, you know, this amazing amount of work is possible because of the collaboration of the team. Mm-hmm. And just to describe a little bit our team, it's made up of principal investigators at each of the four sites, 4 countries, and also postdoctoral fellows, mm-hmm. and at each of the 4 countries as well. And also we have the chance of having patient partners who are involved with our research group, okay. So that we can interact, you know, with them in terms of the relevance of the, especially, you know, the measured outcome. And then the other aspects is that we have a scientific advisory committee made up of external experts in the field from North America and Europe. And I just wanted to tell you who is involved in our team, aside from the 3 of us. Yeah. We have from Sweden, from the Institute of Sciences, Intervention and Technology at the Karolinska Institute in Stockholm. We have Dr. Carolina Kublikiani, and she has 3 or 4 postdoctoral students who are working with her. And then we also have from the Department of Medicine, Division of Endocrinology and Metabolism at the Medical University of Vienna in Austria. We have Dr. Alexandra Katzi-Willer, and also she's supervising 2 or 3 postdoctoral fellows. And we now also has recently been able to collaborate with Peter Klimnek, also in biostatistics at the same institution. And also from Spain, the Clinical and Experimental Neuroscience Institute of Aging Research, Institute of Biohealth Research of Murcia, School of Medicine, University of Murcia. We have Trini Herrero, who's also one of the principal investigators and also is supervising locally also 2 or 3 postdoctoral fellows. Just to also add that we Khaled El Hammam, University of Ottawa, who's joined us in Canada, McGill and in Alberta, to also provide expertise in computer science and synthetic data analysis. So this is a little bit, you know, the constitution of the whole team. How do we work together? Well, we have very frequent Zoom meetings where we exchange with the students exchange in terms of their update with being able to acquire the various databases that are necessary to do the work, the update with harmonization, and update also with data analysis. We had, as Valeria mentioned, we had a kickoff meeting in Montreal at the beginning of the event. And then every month we also have investigators meetings who are coming together to get to supervise and discuss, you know, the progress of the analyses for each of the, you know, various cohorts. So far, we've been able to put together some kind of population-based cohorts in Austria and Canada, and I'll talk about the findings that we've been able to have so far. We have a group of cohorts that's working on the complication of pregnancy, chronic diseases after pregnancy. We have also a group of cohort who's looking at chronic kidney disease and the effect of sex and gender on, you know, need for dialysis and need for transplantation as well. And this is, again, you know, between different countries. And then, you know, we've been progressing with, you know, because as Valeria said, we cannot put the data together, we've been progressing. And I think it's very important as we move forward in terms of big data science to be able to generate synthetic data because of, you know, confidentiality issue. It's very difficult to have data travel, you know, across countries like this. So we're using, you know, state-of-the-art computational science techniques to be able to actually do that, to merge the data, either through synthetic data or through federated analysis. So our group is also very involved in kind of pushing this agenda as well. And then, you know, we developed a website also. You might want to look at it afterwards, where we're updating some of our findings, and then also, you know, some you know, science that's relevant to our consortium as well. The patient partners are also featured on our website.
Okay.
So this is kind of how we work together so far. Despite this distance, I think we've been able to have very productive, and we've advanced quite a bit, you know, despite the challenges that having a multinational consortium like ours represents. But then, you know, that's part of the research question, you know, does sex and gender matter and differ depending, you know, on the healthcare system, the cultures, and also the various diseases that are investigated in our consortium. Well, I think that it has had pros and cons, okay? From the pros point of view, our group has questioned itself about the impact of sex and gender on COVID.
Yes,
and how gender is a major player in terms of, you know, how people in society, men, women, and depending on their gender, you know, roles and relation, how they can deal with the pandemic. And in fact, we've been we've written a piece on that question, the role of gender in COVID, and this is going to be published actually this week. Great. And it's embargoed until today, and we're going to send you, if you want,
absolutely,
yeah, so that you can maybe use that to you know, popularize or, you know, disseminate the role of our consortium. So what I'll send you that.
It will be done.
Yeah, and so that was kind of the pros, you know, interrogate ourselves. We also have one of the databases that we're using is the UK Biobank, and they have collected data on COVID positivity. So we're using machine learning techniques to look at prediction of COVID positivity and incorporating gendered factors. And it's very interesting because we're finding that, you know, for men, biological factors are very important in terms of finding who's likely to become positive with COVID in terms of like medical, you know, conditions, asthma and obesity and chronic illness and all that. But for women, it's really gendered factors, you know, socioeconomic status, education, roles that are actually making them more likely to be positive with COVID. So it's really showing that, you know, gender really matters more, you know, for women than men actually, in terms of gender acquisition of COVID. So this has been kind of the pros. The cons is part of our idea with the consortium was to have, you know, students travel to come for short periods, you know, to other centers to learn depending on the various expertise of the members of the group. So that has been canceled. We also had, you know, some, for example, Trini from Spain was supposed to come to McGill for a 3-month stay in order to, again, interact, and that had to be canceled. And also we have a sort of a summer school. Now it's pushed to October, where also, you know, the going forward postdocs were supposed to travel to Sweden in order to attend the school. But anyways, we're going to do it with Zoom. It won't be canceled, but it has had some impact, some good and some bad, you know.
Yeah.
So
Okay.
it has promoted, you know, more scholarship about the effect of gender on the pandemic, but it also has had, you know, we've had issues and delays in terms of, you know, being able to do the going forward work.
Well, the other thing,
There's been delays in acquiring the databases because people who are providing the databases are not available. So there's definitely been some impact in terms of the productivity of the team.
the final thing too is that it was all hands on deck, right, in every country. And so like Valeria and Louise, I was doing database, but it was all issues related to COVID that,
Yeah.
you know, everything stopped because they were so involved in the, well, it didn't stop, but it certainly, it was a con.
Yeah, a lot of us are clinician scientists, so you know, I did a lot of COVID wards and COVID emergency rooms. So, anyways, it's you know, it's had obviously impact like the rest of society, you know.
Yeah.